Senator Heitkamp.
Thank you, Mr. Chairman. Just kind of to clarify, I think that when we hear 59%, what we assume that means is that every person who is within that territory that you've identified as having access could in fact connect at the speeds that you measure. Is that what 59% means?
Unfortunately, I can't say that it does.
I think that's the problem.
Yeah, it is
Because
definitely
we
a problem.
can't, that number is unreliable. So we're kind of down to, that doesn't mean anything to me. So I need to know what the current condition is. I held a meeting on this in North Dakota, and I can tell you that the issue that Senator Franken just raised, which is the cellular issue, I had people talking about typing a paper, you know, putting it on their cell phone, then driving out to the highest point in the reservation and holding their cell phone up and hoping that that paper transmitted to the professor at UND. I mean, standing out there on the high hill. Because so many people in this demographic area or this census block, they connect wireless. They don't, they're fairly mobile. We have a huge problem with Indian housing, so they don't have a home that is consistent for a lot of them. They move around. Their only connection to the internet is on a cell phone or on a mobile device. And so we've got to figure out how we, to fashion a solution for the population that exists and make sure that we're not building fiber to places where no one's going to use it. They need cell towers. And so we've got to figure out with RUS what's the direct need that folks have. And we've done a pretty good job, actually, in providing broadband access in North Dakota, even in Indian country. North Dakota is one of the most connected rural states in the Union because of the great help of RUS. But we still have gaps in coverage, and I can't stress upon everyone enough the need to collaborate all the federal information, whether it's BIE, whether it's Indian Health, whether it's RUS, whether it's FCC, to find out what the needs actually are. Because having this kind of communication support into the future is absolutely essential. It's essential for education, and it's essential for life and death. And I'll tell you why. Because we can't recruit a healthcare workforce in Indian health facilities in North Dakota. We have to rely on telemedicine. And if we don't have reliable backbone in telemedicine, we don't have healthcare. So, especially in the area of behavior and mental health. So, my question, Mr. McBride, is really what more can be done, and how much, compared to the applications that you get, how much unfilled need is there in Indian country as it relates to support from RUS?
Well, thank you for the question. With regard to unmet needs in Indian country, we're reliant on folks coming in and making application. And certainly with the SUTA provisions, we try to look at those applications and give those priority as we're working through the stack of applications that we have. Our goal is to make sure that we're meeting the most unserved areas, and certainly that tribal areas are included in that. One of the things that we've also tried to do, to your point that you were just making with regard to coordination, under the Broadband Opportunity Council, we're trying to work across agencies to make sure that we're leveraging resources that we do have, not requesting new money, but finding ways to use the programs and resources that we've already been given to expand access. So we're trying to do that.
Well, in many cases, isn't it true that RUS does do public-private partnerships? I mean, you're partnering with
Yes,
the rural telecoms in providing a lot of this service, or with some of the Indian-owned telecommunications companies.
Yes, ma'am. And as you're probably aware, Secretary Vilsack has the Rural Opportunity Initiative, where we have been trying to work with the private sector to leverage our resources with theirs to meet the infrastructure needs in rural areas.
I think one of the most critical things that can come out of this hearing is an understanding that we're frustrated by the lack of data. We're frustrated that we don't know where the gaps are, and we don't know how to fill those gaps, and we're frustrated that everybody doesn't seem to be kind of in the same space trying to solve the problem, working together. And so I hope that going into the future, when you go back to collaborate and you do it in consultation with the people who are actually being served, so you're not building fiber where nobody's going to use fiber, when you could build cell phone towers where people could actually get access, that we actually begin to close the gap, because this will create economic hardship and a lack of economic development for generations to come if we don't fix this problem. And that is a place where in all of our states, we desperately need an economic opportunity. So thank you, Mr. Chairman.